All right, we are so glad you could join us today. What were your impressions of the summit today?
Excuse me, do you need to say who they are? Do you just see their name?
Sure, I will.
Okay.
All right.
Take two.
This is Lisa Charrin with Mitchell Planning, and we are so excited that she was able to join us for our summit today. Tell us what your impressions were.
Well, thanks for having me, Debbie. I thought that this was a great venue. Unfortunately, I hadn't been to the one in the past, but I thought that this particular forum of bringing policy experts together with physicians, nursing, I kind of represent the architecture and equipment planning side of the market, and I thought that with the panelists' diversity and the members of the audience asking questions, a lot of good dialogue. Yeah.
And there was a lot of talk about integration today, and that's one of your specialties. What would your takeaway be, and what would your advice be to those in the healthcare industry moving forward?
So first of all, I think integration is much like the word hybrid. I think a lot of people have a lot of different definitions and a lot of different expectations around what that is. So when I look at integration, it's probably different than how an IT person looks at integration. But I think ultimately what you're looking at is you've got a lot of divergent technologies and a lot of information that's trying to be shared among all these different platforms. So as it relates to the medical equipment world, we look at how these different systems want to talk to each other, how a physiological monitor might want to get that information to a care provider's pager or to the medical record. And so, there was a lot of conversation about finding standards so that healthcare providers can choose products that they know will integrate. I think there's a lot of excitement that we heard around the idea of a lab or some type of a testing market that would help us validate these technologies, much like they do prior to an imaging system or a medical device going out. It has to be approved and cleared. There really doesn't exist something like that for integration.
Right. So you're in a lot of hospitals all over the country. What challenges are you seeing today out in the industry?
Well, I think given costs and trying to hedge their bets for where to put their value is probably the biggest indicator there. We always look at cost, construction. We have issues of people trying to put their money forward, and one of my advices would be, I think, is to spend your money not on looking at the initial cost, but the long-term cost. So, when you look at facility design, it accounts for maybe 1% of the total cost of that building's life. Most of the rest of that cost is in operations. And so if we could put something in place that allows a caregiver to communicate better, or patients to get better care, faster care, then, make those investments.
And you do a lot with imaging. What are you seeing more imaging, and even in the ORs, the hybrids, and the robotics going into other community health systems as well?
So as it relates to imaging to me is a tool, much like a lab. We've seen lab decentralized for many years. We've seen mobile x-ray, mobile imaging taken to the bedside. Imaging as a department really is a misnomer. Yes, imaging is being used in the OR. It's being used in the ICU environment. And so that care model says, if you're a hospital and you need to buy a $2 million CT or an MR, do you want to put that into a place that could be shared by diagnostic use, interventional use, and or surgical use? And so that's a challenge a lot of our hospitals are dealing with, which is breaking down those traditional boundaries between imaging departments and surgery departments and creating uniform platforms that everyone can leverage their investments.
Right. Well, we thank you so much for being here today. Appreciate it.
Had a good time.
All right.